Let me ask you something, and be honest with yourself. Have you ever looked at an NCLEX question and felt like you understood the patient's condition, but still picked the wrong answer? Especially when it comes to nursing diagnosis, because for many students, this is one of the most confusing parts of the nursing process. And if you're an international nursing student, this can feel even harder because it's taught differently. You might be thinking, why can't I just use the medical diagnosis? Why do I have to write it in a specific format? Today, I'm going to break this down slowly, clearly, and in a way that actually makes sense, so you stop guessing and start answering with confidence. This is what I see all the time. A question gives you a patient with low oxygen, shortness of breath, and fatigue. And immediately, your brain jumps to a medical condition like pneumonia, heart failure, or asthma. But then, you get it wrong. Why? Because NCLEX wants the patient's response, not the medical label. Let's fix this. Medical diagnosis equals the disease. Nursing diagnosis equals how the patient responds. NCLEX wants to know what is happening to the patient right now. How are they reacting? A nursing diagnosis is a clinical judgment about a patient's response to actual or potential health problems. Instead of saying pneumonia, you say impaired gas exchange. That's the response, not the disease itself. There are three main types: actual diagnosis, risk diagnosis, and health promotion diagnosis. Actual diagnosis means the problem already exists, like impaired gas exchange. Risk diagnosis means the problem hasn't happened yet, but it could. For example, risk for infection. Health promotion focuses on improving well-being, like readiness for enhanced nutrition. Let's test you. A patient has fever, high WBC count, and wound drainage. What type of diagnosis is this? Pause. Think carefully. What's your answer? Correct answer, B, actual diagnosis, because the signs are already present. Now for something very important, the format. It's also known as the PES format. P for problem, E for etiology or cause, and S for signs, symptoms, or evidence. Example: impaired gas exchange related to alveolar capillary changes as evidenced by O2 sat of 88% and dyspnea. Scenario 2. Patient reports pain 8-10, guarding, and grimacing. What is the best nursing diagnosis? Correct answer is B, acute pain. The symptoms are happening right now, not long-term. This step is critical because your diagnosis determines your interventions and your whole care plan. Use this rule: disease equals medical diagnosis. Response equals nursing diagnosis. Have you been mixing these up, especially if you trained outside the US? Comment below. If you're ready to pass, visit my profile, tap the link in my bio, and start studying the right way with Gab-Nic Excelsior. And don't forget to check my description on YouTube for full lessons. I'll see you in part 3.
Profile. Once you're in, select the RN Refresher course. You'll also find a weekly timetable to help you study consistently and stay on track, so you don't feel overwhelmed while studying. Revisit important topics. It's not just about studying harder. So if you're ready to improve your understanding and stay consistent,